Hey girl, hey. Okay, so this is Dr. Tasha and I am back with Dr. Tasha After Dark. So yeah, here's what I want to talk to y'all about. I want to get in on with my menopause girlies, the Peris and the Menos. Let's talk, y'all. So this girl, what is her name? Being Milani. I love her. Shout out to Being Milani, who started the Menopause Club, Things We Don't Care About. I love this girl. If y'all know her, if y'all see her, tag her. I want her to come on the podcast so we can laugh, joke, do our boots on the ground dance, and talk about things over crab legs that we don't care about, okay? Now, wanted to kind of talk a little bit about peri and menopause. Guys, go back in my videos. I talked all about it, the difference in menopause, perimenopause, postmenopause. I talked all about it, the treatments, all the things. But I talked mainstream stuff. Y'all know I do bioidentical hormones. I don't mess around with this synthetic stuff. I don't care if it's 1%, 2%, statistically insignificant. I am not trying to add any additional cancer risk. Baby, between the food, the water, our community, the stress, all the above, these ninjas who be making us lose our edges, we don't need no additional foolishness, okay? So I do bioidentical hormone replacement, but there is a population of people who don't want it. There's a population of people who they feel like it's going to harm them. They've never taken anything. They're afraid, so they don't want to do none. Even though, bioidentical decrease your risk of everything, heart disease, heart attack, colon cancer, all the things. It's what do you call this? Anti-aging. It helps with bone mass, all the stuff. Gets rid of the hot flashes, girl, the mood stuff, your libido. Baby, you be out in them streets. You be out there fighting, okay? But we have women who don't want to do it. So I want to address today some things that you can do to kind of put yourself together. If you don't want absolutely no hormone replacement at all, but you still want to live your best life. So if y'all notice, I don't know if y'all care enough, but the girl done went back to her ponytail. Why? Because things we do not care about is curling our hair at 7 o'clock in the morning. It ain't gonna happen. It happened for about a month. I could not do it. I didn't see the benefit of it. Y'all don't like my ponytail? Don't care. Drop it in the comments, because they the only people who gonna care, because I don't. Because, baby, it's summertime. I'm not doing it. I don't have time, and I just don't care that much. And at the end of the day, the face card does not decline, so I can pull the hair off the face and I'm still good. Speaking of face, y'all, before we get into this menopause thing, I'm doing a chemical peel, and that's one of the things I want to talk about, just kind of like caring for yourself post-menopause, or post-peri, what that looks like. So I'm doing a chemical peel. I'm doing a VI peel right now. I had some hyperpigmentation, as you can see. Some of it is freckles, some of it is hyperpigmentation from some acne that I had. Whatever. So I'm peeling right now. Don't ever do one yourself. Always have a professional do it. But it's just kind of part of my self-care. So you'll see some peeling. You'll see minimal makeup today. Deal with it. Things we do not care what other people think about us. So anyway, y'all, let's get into it. When we talk about perimenopause, menopause, and all that kind of stuff, I gave y'all definitions before. Again, your perimenopausal girls are going to be girls who have not stopped having a period completely. And stop means 12 consecutive months with no period. If you have 12 consecutive months with no period, the day you reach that 12th month, that's menopause. It's an anniversary day. Menopause is not a destination. It's an anniversary day. After you pass that day, you're postmenopausal. So you're perimenopausal until it's 12 consecutive months without a period. Then on the day of your 12th month, the anniversary day, you're menopausal, and then after that, the next day, you're postmenopausal. But symptoms start way with perimenopause, and I call it menopausal syndrome. So you can have menopausal syndrome whether you perimenopausal or postmenopausal. The symptoms are the same. The treatment is the same for the most part, depending. But the treatment is the same, but we just differentiate where you are in the process. So let's get into it. The biggest thing with menopause, I think, that people or women are focused on are the symptoms. But as a provider, as a physician, yes, I'm focused on your symptoms, but I'm also focused on what it's doing inside your body. We have to worry about your cholesterol. We have to worry about your weight. We have to worry about your heart health, your bone health. I am worried about all those things on top of all of your symptoms, because as your hormones fluctuate, those things start to get altered too. As your hormones decrease, those things start to be a little bit more problematic. So if you're one of my fully, absolutely, completely holistic, I ain't taking nothing, I'm going to chew on some, what do those used to be, chicory sticks, whatever they are, I got something for you, baby. So let's get into it. We're going to go from head to toe. We know that with perimenopause, menopause, or menopausal syndrome, we may develop some hair thinning, okay? With that, I'm going to tell you the best shampoo and conditioner to get is something called a DHT blocker, because that kind of deals with like the hormones and all that good stuff, and blocking is actually dihydrate. Child, it's a long word. Today, this morning ain't the morning, but DHT is actually like a hormone that it can actually block if that's the cause of your thinning. So use that shampoo and conditioner. And then if you are, again, a more natural girly, you want to do things like argan oil. Argan oil is that girl. It's actually good for your skin, your nails, your hair. Argan oil, they call it liquid gold. Get yourself some of that. Make sure your scalp and your hair are well lubricated, and just make sure you're paying attention to those areas. Stimulate. They have this thing that's like the little scalp massager, and it actually, I think it's a LED. When you charge it, you put it up there. My hairstylist was telling me about a child. One of her clients puts it on with a stocking cap, and puts it up there, puts it under the stocking cap, and just lets it massage it for like a couple of hours. And they say that helps your hair grow back and come back. Then I haven't bought one yet. I saw one at Marshall's the other day, but I was like, what is this? I know I, scrape my scalp with it when I shampoo my hair, but I ain't know nothing about the battery operated one. But when they told me what it's for, the girl is going to get one. Hopefully it's still at Marshall's. But if y'all the scalp massager LED people, contact me, send me one so I can talk about what it's doing. Because, the girl is not thinning, but she doesn't want to either. So yes, there's that. When it comes to skin, the best thing you can actually do for your skin, hydrate, girl. Hydrate, hydrate, hydrate. Y'all know how I feel about alkaline water. No disease any way, shape, or form. No way how can live in an alkaline environment. Nothing from eczema to cancer. Okay, so you need to be making your body as alkaline as possible. Eating alkaline fruits and vegetables. Drinking alkaline water. I drink CHA water, chai water. Get it from herbal store. I get it from Medina Halal in Atlanta. But chai, CHA water, I'm a fan. But if you can't get your hand on that or any other type of alkaline water, I know you have a lot of mainstream companies at the grocery stores that sell alkaline water. But water is the biggest thing. And make sure you're eating fruits and vegetables. Y'all are talking about hot flashes and symptoms and this, that, and the third. And y'all out here at Chick-fil-A. Y'all out here at these processed foods, let me say it, processed foods. And you ain't no better if you eating that Chili's, if you eating that Ruth's Chris, it's all processed, sweetie. The difference is whether you have Ramon in the kitchen or whether you got Raheem in the kitchen, but it all comes from the same place, okay? But processed foods cause inflammation, and that's inflammation in your body, inflammation. So you don't want that. It causes swelling, it causes weight gain, it causes your thoughts to be altered, it increases brain fog. You don't want these things. So cook, meal prep. Cooking is a big thing. Please take the time to cook. Everybody's like, I ain't got time. How many days of work you work? 3, and I'm remote. Girl, you right at the house. So meal prepping is a big thing. Not only is it going to save you money, it saves you time. You know what's in your food. Pookie and them, or Rafiq and them ain't went to the bathroom and ain't washed their hands and then coming and chopping up your vegetable. That's always a mental thing of mine when I go to restaurants now. I can barely eat out now. But anyway, so food and water are one of the biggest things that you can do to help your menopausal symptoms. I promise you. Food and water. As far as weight is concerned, what we want to do 9 times out of 10, and here's a formula. If your BMI is greater than 36, then you're insulin resistant. When you're insulin resistant, how much you eat is not really important. What you eat is important. So you could eat 2 donuts, baby, your insulin's through the roof, and you're going to gain a pound. You can eat a pound of crab legs and have some vegetables, you're not going to gain a pound. So what you eat is very important. And when you are menopausal or perimenopausal, we're pushing toward that insulin resistance. So Be mindful of what you eat. Cook your foods and supplements. The one supplement that I would say, I told you guys on a previous situation, yacon root, and it's YACON, yacon root. They got liquid, they got syrup. If you ain't a pill taker, they got capsules. I do the capsules. It's one a day. I like it so far. I'm about to bust up and start doing 2, because why would I listen to instructions? I'm gonna go ahead and do 2 because I likes the 1. Don't follow me, okay? But it's supposed to kind of help with like insulin resistance, insulin sensitivity. It helps with weight loss. It helps with appetite suppression. It helps with cholesterol. Just read about the benefits. In a previous post, I think on Instagram, I listed all the benefits of yacon root. But if you list benefits of yacon root, y'all can, Google it or whatever. I like it so far, and I'm going to recommend it. I also recommend a couple of things. Seeing an herbalist, and if you're into Chinese medicine, seeing an actual acupuncturist who understands, knows, and practices Chinese medicine. Don't just go to your random whoever who telling you whatever, some stuff they Google too. No, Chinese medicine is just as potent, sometimes more potent than Western medicine. So you wouldn't go to some random person and let them give you a prescription for something. You want to know, and you want to go to somebody who knows what they're doing. So that's what I think you need to do, sis. But I'm a lover of Chinese medicine, so I travel to somebody who I trust. I do acupuncture, I do acupressure, and I do take Chinese medicine for different things. So yeah, I think that that's also an option as far as hot flashes are concerned, because that's a big one when it comes to herbs and hot flashes. And please understand that these things are herbs and medicines and supplements. It's not magic. Y'all want to take something for a day or 2 and be like, that don't work. No, you have to build it up. It has to get into your system. You have to take it for a while. And that's why I say find an herbalist, because I don't know what medicine you want. I don't know all the stuff it crossed with. I got other stuff I need to think about, learn, and remember. I can't be thinking about what y'all herbs is crossing with and all that. But as far as hot flashes are concerned, there is something called wild yam root. Okay, wild yam root is great for suppressing hot flashes. Okay. Now, but again, you're going to have to take it. You're going to take it for a while. For somebody who does not mind going to their gynecologist, there's something called Veozah, and it's Veozah. Veozah is a medication that they use to counteract hot flashes. Now, again, about this Veozah, it is medicine. It ain't magic. It is not a hormone. I don't even know what it is. I ain't gonna lie. I'm not big on it because here's this. It's brand name, which means it is not cheap. And y'all know how these insurance companies are, especially in Georgia. Baby, they don't want to pay for nothing, okay? But at the end of the day, I don't know how expensive it might be, but to my understanding, you're going to take it for about 3 months before you start to see a result. Now, I got to look at that as a provider and say, the patient is going to take a medication that is expensive every day for 3 months before they start seeing results. Child, how many of y'all gonna stick with that? Next to none. So I'm not big on it. I've probably prescribed it once for a patient who I educated about it, and she wanted to try it. I have not refilled it for her, which tells me, yeah, but I'm not talking down about it because, again, I don't know enough about it and I haven't prescribed it enough. But it's out there if that's something that you feel like you want to discuss with your particular provider. Boom, bam, bit. That's it. So the hot flashes, that's all I can really give you. The wild yam root, if you want to go the herbal route. The Veozah, if you want to go the medical route with no hormone. Okay. Now, I have to say, and this has been a challenge, a lot of, women start to go through Peri around 40, 45, whatever the case may be, 47. That is young. Okay, the average age of menopause is 51, which is young. And we're seeing a lot of women go through it earlier. I told y'all, because of the food, because of the weight, because of so much stuff that we have going on, we're seeing it early. Well, we're in relationships, we're in marriages, we're in situationships. We just trying to be outside. Maybe we just straight up single. And we have a plethora of people that want to be pleased or that we want to please. But just the desire is not there. Well, the challenge in medicine has been men got Viagra, they got Cialis, they probably got some other stuff too. I don't know, I don't keep up with it. But the thing is women, you go to your doctor and you're like, oh, I just don't want to have sex. The first thing they're going to offer you is an antidepressant. Did I say I was depressed? I said I don't want to have sex. I didn't say I was depressed. One is synonymous. So let me understand. I don't want him to touch me, so I must be depressed. It's ridiculous. So the thing is that we don't really have a lot to help us in that window. And this is why I really push for bioidenticals, because I know it works. I'm a pellet girly. Yes, the girl's a pellet girly. No shame to my game. I love it. But at the end of the day, there's really not a whole lot. People say, oh, maca. Yes, maca, you take enough of it. I don't know if it's a tea or not. I know we use it with our vag steam. It is a part of our vag steam. I guess you can get it in capsules. I'm not really well versed on how to deal with maca outside of the vag steam, but maca root powder is one that is said to help with libido, maca. But listen, again, it ain't magic, and you're going to have some patience with it. And again, all of this should be tailored to you, your medical problems, and your symptoms. Everybody's not going to need everything. You get some girlies who have hot flashes, but they still hot in the wrong. They are out in these streets. They are like, nope, I don't have no problems with vaginal dryness. I'm wet. I'm trying to bust down on a regular basis. I ain't got no problems. The girl just can't. I'm hot. I get agitated. I get the popping sweats. It's nasty. You're going to have a particular routine and a regimen. If somebody's like, no, I don't have hot flashes. I just don't want him to touch me. I don't ever want him to touch me. And when he comes my way, I just got to fake like I'm asleep. Your regimen is going to be something different. So, and if you're unfortunate and you're the girlie who got all of that, yeah, well, you got to pick. You got to pick your battle, pick your poisons, pick your herbs, and do what is going to be best for you and your situation. But if I had to give you a top 5, here's going to be my top 5. Please be conscious of what you're drinking and eating. Make sure you're hydrating well. If you have a fluid restriction because of a health problem, talk to your healthcare provider. But I tell my patients at least 80 ounces of water a day. Pay attention to what you're eating. Don't be like, child, I'm gaining all this weight. I can't really get rid of this weight. I'm agitated. I don't want to do it. My coochie dry. Can I have a number 5? Put some extra sauce in there and light on the ice. This ain't for you. Okay, you need to be down the street at the other podcast. This ain't for you. But if you are in a situation where, because this is the time where your body's saying, you done the thing for 40 years. You done had the wings with the special sauce for 40 years. You done had the nuggets. You done sat and ate bags and bags of M&Ms for 40 years. I can't keep going like this. I can't keep doing this. And it's a situation where food is fuel. I don't care what kind of car you drive. I don't care how seldom you drive it. Okay, at some point you're going to need to put some gas in it, and your body's the same way. Food is fuel. You're going to get out of your body exactly what you put in it. You put garbage in, you're going to feel like garbage. You're going to think like garbage. People don't understand how much your thoughts are based on what you eat, and the power of life or death is in the tongue. You can really bring about a situation by speaking life into it, by speaking positivity into it. But if you feel like garbage, your mindset is like garbage, you're not going to do that. And if you're putting in garbage, that is what you'll be getting out. A lot of times I can tell when women come to see me, I don't care what you tell me. Half the stuff that people tell me is BS. That's why I'm like, listen, be straight up with me. Stop sugarcoating. Stop being phony. I'm going to know if you're being phony anyway, but I can help you if you're straight up with me. If you're not straight up, I'm going to give you the plan that your representative would have, not you. And you wasted your time, you wasted my time, and you wasted your money. Okay, because it ain't cheap over at Atlanta Premier. Okay, now, case in point, the reality is that I can tell when women live well. I can tell when you live well. I can tell when you're cognizant of what you're putting in your body. I can tell when you're eating foods that do you well. I can tell when you walking. I mean, just extra. I can tell when you do your body well because of the energy that you come across. Because of, and some women don't say anything wrong, they don't say anything bad. It's just bad energy. It's just, and that is a reflection of how you care about yourself. And so this should be the time in your life where you want to be the best version of yourself. It's the most challenging time for some of us, but you want to be the best version of yourself, sis, and live up to that. You want to walk in that. The beauty. And I'm going to tell you, a lot of people, and we started to do a show about this, but I really couldn't find, I don't know enough about YNs because it ain't my jam, okay? And y'all know what I'm talking about with the YNs. But a lot of YNs actually favor older women at this point. Why? Because you have that sense of calm, because you've had the experience. You have all the things that they're looking for, minus the BS. But you have to walk in that confidence and, not trying to be young, but trying to be the best version of yourself. So my thing is that should not just be reserved for women who are willing to come to the doctor, but like, give me this, give me this, give me this. I respect the fact that some women have fears. Some women have medical conditions. Some women just have beliefs that they don't want to do certain things. And I respect that. So I try and give alternatives for my girlies who, not with, as we call it, not with the shits, but at the end of the day, they still want the help. They still want the help. They still want the relief for the symptoms. So like I said, the biggest thing, top 5, is going to be water. Please. It's going to be food. What you eat, how you eat it. Okay, figuring out what your actual issue is. Physical activity. It don't have to be a gym. It don't have to be working out. And please, for the love of Jesus, to be perfectly honest, if you're insulin resistant, it shouldn't be weights. I don't care what any trainer tells you. And jump in the comments, because I might have time and I will verbally destroy you. Because at the end of the day, we all are overweight for different reasons, as am I. And we lose in different ways. So group training kills me, because you're actually supposed to train somebody's metabolism, not their body. A lot of trainers don't get that. They don't understand that. And everybody's in the same class doing the same things. And if you're insulin resistant, weight training is going to make you gain weight. And I'm sure that was an aha moment for a lot of women. Like, I've been going to this damn gym and I'm lifting these weights and I'm just getting bigger. I knew it was something. Yeah, it's something. So anyways, and if you want to talk more about that, weight management, metabolism management over at Atlanta Premier, we can help you out. But case in point, so food, water, food, physical activity, a big one. People don't understand. Oh, I'm just walking. Walking decreases your blood pressure, your blood sugar, and your anxiety and depression. Girl, get out there and walk. Walk. It's a big deal. And then supplements. If, make sure you're taking your regular medication. But y'all know multivitamin. Y'all know I don't play about vitamin D. If your primary doesn't want to give it to you, oh, your levels are fine. Your primary don't want to give it to you, D3 over the counter. Take at least 2,000 a day. I'm for the once a week. One, you're going to be more compliant if it's once a week, but I'm all for the once a week. But the vitamin D, the multivitamin, again, yacon root is controlling your appetite and controlling insulin resistance, and pre-diabetes. That's really what it's great for. Yacon root is that girl, okay? And just please, if you focus on water, your diet, and physical activity, that's about 70-80% of the battle right there. While yam root is a good supplement, yacon root is a good supplement. All of those are good supplements to help with the symptoms. Also to help with libido. That's what I'm trying to say. It's brain fog. Libido is is maca root. So look into all those, ladies, and don't be ashamed if you're like getting your second win and you like, yeah, I want to do some things. I don't really talk about the plastic surgery thing. I really don't have an opinion about it. I tell everybody, be the best version of yourself. Just stay safe. So, as far as menopause is concerned, we go through a lot of changes, emotional, mental, physical, and we just want to feel like our younger self. We just want to feel like the best version of ourselves. And at the end of the day, just be very careful, because people will try to sell you What do they try to sell you? They try to sell you a medical logic. Oh, well, this is what's happening in your body. They don't know what they're talking about. It's full of BS. And at the end of the day, they're trying to sell you something. And be careful with that word natural. Natural, non-GMO, holistic. Oh, I believe in all of it. But at the end of the day, it doesn't really mean a whole lot. You can name all those things, and all of those things will describe things that are bad for you. Cocaine, other drug. Okay, and I tell people, stop saying I'm a naturalist. I just want to slap the hell out of people when they come in my office because you sound stupid. You sound stupid. What the hell is a naturalist? You sound stupid. I tell people, listen, let me help you sound a little bit more educated. Let me help you sound a little less ridiculous, okay? Say I'm a minimalist. Give me the minimum amount of what you have to give me so that I can maintain my health. That makes sense to me. But to say I'm a naturalist, what does that even mean? Like, I don't even know where to go with you, because you could naturally just take, your blood pressure pill every day and naturally stay away from dialysis. So what are we talking about here? So say you're a minimalist. You want the minimum amount of medications or anything else that will help you maintain good health. And then you sound like somebody who understands what they're actually trying to achieve. But anyway, I done rambled on enough, girls, because I know, again, things we don't care about. 2-hour-long podcast, okay? So at the end of the day, point blank period, I hope you guys took notes. I hope you are getting from this video what I'm trying to convey. I'm trying to hit everybody. This menopause thing is rough, baby. Y'all don't understand. It sounds like it's just on a regular day you minding your business, trying to do good for the community, and Lucifer opens up his mouth on the back of your neck and your whole body goes to 400 degrees Celsius, okay? And you don't understand what's happening. You don't understand how long it's gonna last. You can't come out your clothes. I don't even know. I don't even know how to explain it. With the night sweats, over the cover, under the cover, over the cover, under the cover, the air conditioning on, sometimes the fan, depending on how you live, the windows are open. And by the time you find that perfect temperature at 6 a.m., your alarm clock is going off at 6:30. So it's not a pretty place, but we got to get through it, y'all. Our parents didn't talk about it. Our mamas didn't talk about it. They understood it was just a way of life. So talk about it for what? No, we talking about it. We talking about it, and reach out. Baby. Grab your sister. If you send this video to anybody who you think needs it, send this video to anybody who you think can use it. Because we have to start to embrace there are things out there. There's a better way of life. No, we don't have to deal with this. No, we don't have to increase our risk of cancer. No, we don't have to be on a whole bunch of hormones. There's a bunch of ways that we can deal with this, but we got to start talking and we have to start listening. So I hope this video helps somebody. Again, this is Dr. Tasha. I'm over at Atlanta Premier. Yes, I do metabolism management. Yes, I do hormone and menopause management and treatment and all the things. Come over there and see me, ladies. But again, until then, this is Dr. Tasha After Dark, and thank you so much for joining.